Thank you so much for taking the time to talk to us, Doc. We know now vaccines have started rolling into the country. We got in 1 point something million, right? And now with the latest, above 58, they've opened up to go and get the vaccinations, right? We are getting the AstraZeneca vaccine. Does this protect against the new variants that are there of COVID-19?
Okay, so one of the responses that in any country or region, you get what we call the predominant variant here in Kenya. There have been cases of reported South African variant at the coast and the British variant, but those are few and isolated cases.
Right.
They are not yet the predominant. So it is effective against the predominant variant here in Kenya.
Okay. So now this AstraZeneca, you have 2 doses, right? And what's the time difference between each dose?
The time difference recommended by WHO is 6 to 12 weeks.
6 to 12 weeks. So how long does it take to get protected fully?
Full protection is after 3 weeks after your second dose. To explain clearly is that once you get your first dose,
Right.
your second dose will be after 8 weeks, which is 2 months. During that time, you get what we call partial protection.
Okay.
When you get your second dose, it takes 3 weeks to get full protection.
Okay. So now, can I just ask you, for this one, are there any specific side effects when you get this vaccine?
We are monitoring the side effects, and if there are any serious ones, we are recording them and doing a follow-up. So far, we've now vaccinated over 80,000 Kenyans. I think by this morning, it's around 85,000.
Right.
And no major serious side effect has been reported, but a few people have complained of some headache. A few people have complained of just feeling tired. A few people have complained about pain and feeling a bit of numbness, but many of them are resolving, especially after 48 hours.
So it's not too badly off. Thank you for that. Also, now, let me just ask you, there are a lot of people that are kidogo reluctant to take the vaccine. What do you have to say to people like that?
Yeah, reluctance is not a good idea now. We must realize that we are in the third wave. The third wave seems to be very severe. There are more people getting sick. It is highly infectious. The vaccine is very good at preventing severe disease and death. If you are vaccinated, even if you are infected, you will not get severe disease. So it is highly recommended that one takes this vaccine.
Okay.
Very highly recommended that you take this vaccine. Don't listen to misinformation. Don't listen to misconceptions. Listen to what the scientists are saying. Read through what the scientists are saying. Then make yourself that informed decision. Yes, make it yourself. Don't be influenced by misinformation.
Now, speaking about the misinformation and, the misconceptions about the vaccine, a lot of people have this notion, and I've seen this for myself, that we've got the vaccine, I don't need to wear a mask anymore.
That is very far from the truth. In fact, if even after vaccination, you can still get the virus and you can transmit the virus. So the whole issue about fight against COVID, you need to protect yourself, but you must protect others as well. So at this time, one has to really ensure we comply with all other measures of protection that have been outlined by the Minister of Health. The scientists and medical workers are monitoring how the vaccination will impact transmission. But as of now, really, one has to continue protecting themselves.
Okay. Now, one more misinformation that we are getting is regarding the Russian vaccine Sputnik. Now, what's the situation about that? Is it being approved? Has it started rolling out? Because a lot of misconception has been happening about this one.
So, the regulator in Kenya who deals with the registration and importation of vaccine is the Pharmacy and Poisons Board. So,
Right.
Pharmacy and Poisons Board did indicate they had issued what you call emergency use authorization.
Right.
But that is not equivalent to market authorization. So there are certain requirements that anybody who is bringing vaccines in the country must meet, and the Pharmacy and Poisons Board has published them on their website, and I think they will be publishing them also in the newspapers. And these requirements have to be met before a vaccine is used even in the private sector.
Okay, so if anybody is actually offering it, they should actually be told not to get it done.
At this time, it is not been approved. It is authorized for use, but not yet approved.
Not yet approved. Okay,
Yeah.
Doc, now I want to ask you, is it possible to mix vaccines, or if you stick with AstraZeneca, you have to get both AstraZeneca?
At the moment, once you start with one type, you stick to that one type. Actually, in Kenya, I know we are soon going to get more than one type available in Kenya. So
Right.
if you start with AstraZeneca, get a second dose. If you start with Johnson, it's a single dose. If you go Pfizer, get both doses. And if it is Sputnik, you can do that. So one has to stick to it. What people are monitoring is how long after the second dose you are protected. We seem to think it could be 1 year. There's now people trying to project. Remember, these vaccines just started being injected in that December in the European and America. So that will be monitored. Maybe in the next season, one can change the vaccine, but not during the same period of the year.
There's a question that I was asked. If somebody is positive as we speak, right, can they get the vaccine?
Yes, they can get the vaccine as long as they don't have a fever. When you have a fever, you cannot be vaccinated for obvious reasons, or the temperature could go outside control.
Okay.
So, but if you don't have, there are people who are asymptomatic. You
Yes.
have the virus, you are positive, but you have no symptoms. You can be vaccinated.
You can be. And if you've had it in the past, can you still get it?
You can, even if you had in the past, you should be vaccinated.
You should.
Because, yes, even if you got it in the past, they have found that the chance of a reinfection is possible. And also remember, variants may start coming. The coronaviruses are known to change very fast. So it would be good to get vaccinated.
Okay. Doc, I want to thank you so much for your time. Now, the last thing to close, if you can maybe just speak to the listeners to just educate them that, get this vaccine, and getting this vaccine does not mean that you drop the ball in terms of not wearing the mask, washing hands.
Okay. So, my dear Kenyans, this is the chairman of the Vaccine Deployment Task Force, Dr. Willis Akhwale. I want to urge you that this is the time you have a chance to protect yourself from this debilitating pandemic, the coronavirus disease. The vaccines are now available. They will protect you from getting severe disease, and they will save your life. They have been found to be safe and effective. To date, we have now vaccinated over 85,000 Kenyans, and most of them have found them not to have any serious side effects. Most of the minor side effects are headache, a little bit of feeling tired, and joint aches, but these subside so soon, and not more than 48 hours. Make the decision to get vaccinated. I have been vaccinated. You need to be vaccinated. We should all be vaccinated to have a safe and healthy Kenya. So, fellow Kenyans, once you've been vaccinated, it does not mean that you cannot transmit the virus. It also does not mean you cannot get the virus. You can get and still transmit to other people. The only thing the vaccine does is to protect you from severe disease. So, at this time, it is so crucial that you continue keeping your guard. Put on your mask, ensure you continue social distancing, maintain the highest level of hygiene, sanitize, wash your hands as regularly as possible. Always remember that during the Spanish flu of 1918-1919, the second wave killed very many people because they had dropped their guard. Keep your guard. Thank you.
Thank you so much, Doc. I really appreciate your time. Thank you so much.